Family keeps complaining about medical care, so the nurses get family involved in patient care. Patient came in and develops difficulty swallowing. So the poor patient can't eat or swallow without choking and possibly acquiring an infection. Doctors put in a tube in Petey's stomach to feed them with liquid food and bypass the esophagus. At first point was being fed through a slow drip controlled by a machine. Then family complained that patient wasn't tolerating the continuous feed, so the doctor took the machine away, and now I and the other nurses would have to go into the room 3 times a day to feed point manually. Family complained the next day that the patient's stomach was bloated, so doctor changed order to 4 times a day a nurse would have to go in to feed the patient. Next day family complained point wasn't pooping after not eating for several days and undergoing a surgery, so that's to be expected. But the MD caved to the family's complaining and changed the order to every 4 hours. Then family freaked about patient being short of breath and blamed the liquid tube feed, even though the patient has history of respiratory disorders and is on chronic oxygen. Still, MD changed the order to every 3 hours a nurse has to go in and manually feed the patient through the tube in her stomach. I know I was fed up with the family bitching about every tiny little thing, and more so at the doctors for caving in without explaining the reality of the patient's condition. The patient is old as balls and probably won't get better. Family complained again the next day. Claimed the patient was having chest pain. Red flag for heart attack. But the family blamed the liquid tube feed. Why? MD caved again and changed the order to every 2 hours. Every 2 hours I or whoever was taking care of the patient would have to go in there and spend 20 minutes in the room dealing with the patient and her family. As many people now know, nurses do not have time to dick around. We barely have time to pee. So, malicious compliance. This patient is not going to get better, so family needs to know how to feed her through the tube. I educate family and show them how to do it at 6 p.m. I make sure to turn on all the lights, turn the TV off, and get family really involved. They wash their hands, they put on gloves, handle the peg tube, etc. Then at 8 p.m. I make the PD's son do the tube feed. It takes half an hour and I can tell the son is freaked out. Then I go back in at 10 p.m. Midnight, 2 a.m. By 4 a.m. the son was complaining that I should be the one doing the tube feedings because it's so often. He looks exhausted and terrible. I tell him flatly that it's not rocket science and that he's going to be doing the tube feedings himself at home, by himself with no backup nurse. He takes forever to do the 4 a.m. tube feed because he is so tired. Afterwards, while he's watching me clean up the patient, he comments that the patient seems to be tolerating the tube feeds better and maybe we can go back to doing it every 3 or 4 hours instead of every 2 hours. I look him dead in his bloodshot eyes and say that when the doctor orders something, then there's no wiggle room. It's literally the law. Because of the family's multiple concerns, it's every 2 hours until the doctor signs a new order, and that I'm going to be coming in, flipping all the lights on every 2 hours until I go home. The look of defeat on the son's face was so sweet and almost made the every 2 hour nonsense worth it. What is sad, in my opinion, after working 25 years in LTC and hospice work, is that families are not educated nor realistic on the end-of-life issues. Tube feeding either bolus or by drip, machine calibrated, in the very elderly that are going, though the dying process is not a solution to end-of-life care. Not meaning tube feeding for injury or chronic illnesses. The elderly often have multiple system failure, and that may include eating and digestion. This is why everyone should discuss with their family on what or how they want their end-of-life care to be. Take the time to get educated on what tube feeding entails, and that isn't always a comfortable choice for the aged, dying person, especially if they cannot give you input or direction or failed to do an advanced directive. Do yourself and your family a favor and create a gift of understanding by creating an advanced directive and discuss it with your family. The last thing is, don't choose someone as your surrogate decision maker if they are the same age as you or someone not emotionally able to make decisions that aren't covered by you in the advanced directive. I'm off my soapbox. Remember, nobody gets out alive. Be kind to your family. Make the decisions in advance. I love getting the patient or family involved in situations like that. Had a patient with an extensive abdominal wound vac and it was leaking multiple times per night and had to be changed frequently. We started suspecting the patient was playing around with it and started making her do most of the work to change it. Well, what do you know? Her wound vac made it until the scheduled change. A miracle. Open mouth smile, woman shrugging, light skin tone. I pray that I don't go like this. God bless hospice and those who work in end-of-life care. Arg, it's so annoying that the doctor isn't advocating for that patient. We often do continuous feeds overnight, so the patient doesn't have to be woken up every 2 hours and can be disconnected for a bit during the day. That or bolus feed during the day with a 6-hour break overnight so they can rest. Sometimes showing people the reality of what they want is the best way to deal with it. Great idea. I work in nursing homes, and having family direct the patient's care makes all of us so angry. Often it's out-of-state family who hasn't seen the patient in several years, and family overrides DNRs all the time. Please let staff and nurses help your family member. It's what we're trained to do. And we actually do care. Listen to them when they suggest hospice. Pain meds more frequently is one benefit. Or try to explain something to you. Let your loved one pass gently in the nursing homes surrounded by staff who knows them well and cares about them. And vice versa. Don't insist they go to a hospital where every bone in their elderly chest will break because you insisted on overriding a DNR. And staff had to do a full code CPR. Then send patient to hospital where they die among strangers. Caring strangers. But still strangers. With a chest full of broken bones. Okay, enough. I'm off my soapbox now too. In this case, the patient was probably in the dying process. Their body knew they didn't need food anymore. Yours will too one day if you die naturally. Instead, the family jams food in a peg tube. Last thing that poor patient needed. No doubt the patient died. But not as gently as they could have. Fuck that family and every family like them. How awful for that patient having the MD write up for interventions every 2 hours. They must never get quality rest or sleep. That is totally not patient-centered. At least the patient's family was there instead of just refusing a DNR and cashing Social Security checks. My now ex-husband and I were the sole caretakers of his grandmother in late-stage cirrhosis of the liver. She didn't drink. FYI, she was at home in hospice. The hospice people told us that at some point she'd start refusing food and that we should not force it upon her. This is really hard to do because, as humans, we know we need to eat in order to live. But we did it. Once a month her son and daughter-in-law would take over for a weekend so we'd have a break. They ended up being with her when she passed after they force-fed her a meal. I regret leaving her with them. So how did the story end? As a nurse, this was very satisfying. The only thing that would have put the cherry on top would be to wake up the damn doctor every 2 hours so they're as inconvenienced by those stupid orders as you were. Yes, thank you. I forgot to add for elderly people. I'm glad you were able to give them comfort while they're dealing with their dying family member.
Well done. This is great.
We need to know part 2. Very clever. Ah yes. I do not miss my direct care days and certainly don't miss those night shifts. Good job. Pleading face Nazar Amulet White Heart. Why was she not given an ing tube first? Peg tubes for that old of patient. If she really is that old. Do not give any more end-of-life success. And if she's not that old, then why are they not getting speech therapy? Sounds like some questionable things happen in your hospital. As a nurse, this feels like a gotcha bitch kind of moment.
If you enjoyed this video, please check out our playlists full of similar content. Epic Ericast is like doom scrolling for your ears. Please like, share, and subscribe.